Hi, I'm Dr. Sterling Wood. Thank you for visiting my YouTube channel. I'd like for you to like it and subscribe, please. Always wanted to be a doctor all my life. My father was a doctor. He was a kind and caring man, and he told me that life is about helping people, not worrying about the money, help the people. I learned that at an early age, and he instilled in me to be a good doctor and a professional. And at a very early age, I learned one thing, that modern medicine is not all it's cranked up to be sometimes. My mom was a world-class athlete and a beautiful lady, and when I was younger, she started talking to imaginary people and walking around the neighborhood confused and had to be retrieved by neighbors and people and brought her back home. And my dad took my mom to a psychiatric hospital for help, and they told her that she was schizophrenic of the worst degree, and they wanted to reverse shock her brain. And she was scheduled to have that procedure, and an internal medicine doctor my dad found came in and looked at my mom in the hospital and said, "Oh no, whoa, whoa, whoa. This lady appears to be hypoglycemic." So he ran a 6-hour glucose tolerance test on my mom and found out that she was really, really badly diabetic. Hypoglycemic. And so he started making my mom eat 7-8 times a day, and she was my mom again. And she was great. She was happy. She wasn't talking to people. And I learned at an early age that you don't have to always follow the prescription plan or the surgical plan. And I took that into my practice, and I did so much surgery. My job was saving the foot of a diabetic patient in trouble, and amputating parts and restructuring the circulation with a vascular surgeon. And I learned that, that if I could not put my patient to sleep, avoid all that unnecessary trauma of being induced in general anesthesia. So I said about 90% of my patients were never put to sleep. I used local anesthetic and something called IV sedation, and they were able to get through it and not feel a thing. And I felt good about that, and I was one of the first people to introduce intravenous vitamin C after surgery in the surgical line, and saw great changes. So I've always been geared towards preventative medicine and trying to do with the body, nourish the body, because the body is the greatest healer of all. Give it what it needs, give the brain what it needs, give that great computer what it needs, give that great engine what it needs, and you're going to be a great person. And I've always focused on that. And during my practice, in the early years of my practice, I was very, very fortunate to meet Dr. Barry Sears, the famous author of The Zone at Harvard. And before his book was even published, I met him, we talked, and he introduced me to the people that won the 1982 Nobel Prize in Medicine at Harvard for a whole system of hormones called eicosanoids, and the most powerful hormones your body produces, and how to engineer foods to produce these hormonal responses. So in my practice, I didn't have anything but a diet, and I worked really strong with my patients and wrote out diets and helped them, and they all got better. They got off their medications in many senses and felt better, lost weight. All blood levels sort of returned to normal. They were doing great, but people just don't want to stay on a diet. So I figured that out, and I was doing a great job saving legs, but I wanted to make more of a difference, like my dad told me, make a difference. So I went out to develop this product that the people at Harvard had told me about, how to engineer food. And it was really difficult because it's very difficult to put equal amounts of a fat, protein, and carbs in a ready-to-drink milkshake, which is very difficult. So it took me almost 14 years of trial and error to develop this product. And it always kept in my mind that I was going to help people no matter how difficult it was. And finally was able to get this product engineered so where it's 35% extra virgin olive oil in a powder with something called nanotechnology to help you absorb it better, mixed with proteins and slow to digest carbohydrates in a great tasting milkshake. And I'm just really happy about this product, and I want to help everyone. So please focus on my YouTube channel and look at some of the great lectures I'm going to try to provide for you. Thank you very much.